Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HS St. Anthony's Memorial Hospital.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
At Carl, we dedicate ourselves to helping you be great. And we have the expertise and inspiration to help you stay that way.
Hi, I'm Keanne Armstrong, and I'm your host of Being Well. And today we're going to be talking about a treatment for Parkinson's disease. And joining me today, I have Sheryle Hendry, a physical therapist assistant, and I also have Brenda Stevens, a speech pathologist, and both with Horizon Health. So thank you so much for joining us today.
Thank you for having us.
Yeah, so we've got a lot to talk about. We're talking about a program for Parkinson's disease. So why don't we start out talking a little bit about Parkinson's and then delve into the program.
Okay. Parkinson's disease it happens when the dopamine production in your brain is decreased and diminished over time. They don't really have an exact cause for that decrease, but when that happens, your movement, every movement that you make, when you walk, when you write your name, or even if you reach into a cabinet for a coffee cup, becomes smaller because the dopamine is the neurotransmitter in your brain that helps your body move the amount it needs to for movement.
Okay.
Parkinson's disease can also affect the sensory system and the ability of a person to kind of self-regulate their movements and to know either how big their movements are or how maybe loud their voice is. So it really has quite an impact on someone's life.
All right, so it's a signal coming from the brain telling your body what to do, but it's also a signal from your brain telling your speech and whatever you're trying to get out, which I'm not talking real well right now either, but like the speech part. So it's your whole entire body and what's happening and how much it's actually working, right? Right.
Yes, and I think a lot of times people associate Parkinson's with tremors.
Okay.
And tremors can start in just one digit on your hand, just a slight tremor, or they can be very encompassing. Your hand movement, your head movement can be uncontrollable, which of course that then becomes an issue for the medications that they try to control those so that you can move more normally as well.
Okay, so let's back up just one moment. How does a person know whether they have Parkinson's disease or whether it might be something different? Who do they go see and how do they get diagnosed?
A lot of times people do not know. They might they're not moving like they normally would. A lot of people start with their family physicians.
Okay.
Family physicians will usually send them to a neurologist. Mm-hmm. It's very helpful if you have a neurologist that works with Parkinson's patients a lot. Every Parkinson's patient is different, so it can be a puzzle that you put together.
All right. So we're here to talk about a program that helps with Parkinson's disease and patients suffering from this. Mm-hmm. So you're going to talk about a program that deals with what you just explained, with the gait and the walking and different things like that. So what is the name of the program? What does it stand for? And then talk to me a little bit about it.
It's called the LSVT Big program, which actually it stands for Lee Silverman Speech Training Program. That's how it started years ago. But the program that we have it's a specific exercise regimen that the exercises are very specific. They're done in a specific order multiple times a week. Very, very repetitive.
Okay.
We're retraining the muscles for amplitude to make those bigger movements. Usually patients come in with a shuffling gait pattern, very small. They lean forward. Parkinson's patients usually feel like they're falling backwards a lot. So they naturally move forward, which slows their gait. A lot of times they don't realize how slowly they're moving. The exercises program that we do is very large movement so that your muscles can feel how much they need to move to achieve a bigger movement.
Okay.
So we're really working with muscle memory there.
Muscle memory. So in turn, is moving the muscles help sending a signal back to the brain? Does it work that way, or how does it function if your brain's trying to send the signal out and then you're kind of working against that maybe?
Well, the brain actually kind of stops sending the signal.
Oh, okay.
That's
All
the
right.
whole idea, because you're training your muscle to do what the dopamine should be doing, should be sending that signal, and it's not. So you're using that muscle in a way that your body can feel how it feels to move big again.
Yeah, move big again, because if you're not getting those extended gaits, then your muscles are going to become tight and rigid, so you want to keep that from happening.
Absolutely.
Okay.
Absolutely.
All right. So who performs this program? Do you work with the patients that come in? Do you have a team of people? How does it work?
We have a physical therapist who is in the process of becoming certified in this program. She would do the evaluations. I do work with the patients. And Brenda then takes over on the speech portion.
Yes, I'm in the process of becoming certified in the LSVT LOUD program.
Okay.
And this program addresses the speech and voice issues that come along with Parkinson's disease. Many of the patients will report that, well, my husband says I mumble all the time, or none of my friends can understand me. I have to repeat myself all the time. And it can become very, not only frustrating, but it can also make a person feel pretty isolated. If they're in a group and they're not able to be understood or to be heard, they tend to just kind of stop participating. And so we really hope that by implementing the LOUD program, the Parkinson's program for the voice, that we can help them overcome some of those things.
So you work together, you work hand in hand?
We don't, the therapy will not be simultaneous. She'll have a separate session than I will, but oftentimes we do see the same patients, because obviously with the diagnosis of Parkinson's, about 89%, the research shows 89% of Parkinson's patients have some sort of voice or speech disorder. So yeah, the whole person is affected, so we each get our own separate time to address that.
All right, well, speaking of time, how much time is involved, and do you come to the office to do it? Are there things that you do at home as well? Let's talk about that.
Yes, it is a very time intensive program. 4 days a week for an hour each day. They would be coming to the therapy department to perform the exercises. And then there is a homework program that you do as well. Ideally, people will do this program twice a day because the repetitive nature of it, again, it's all about muscle memory. And the more they do it, the more they are able to maintain it.
Okay.
And it's the same with the speech side. The program is intensive. They come, 4 days a week, an hour each time for a 4-week period. And again, it operates on the same theories of motor memory. We want to retrain those big motor movements in the face and vocal tract to help that person improve their voice.
Okay. So for folks who are suffering from Parkinson's, maybe they're not as mobile as they want to be. I mean, do they need to have people bring them? What's the process, and how does it include family members or friends that maybe are associated with your patients?
I encourage family members to come. I believe that if their family members will work with them to do the exercises, they are more likely to keep doing it. And the longer we can get that, the more, staying power it has. I mean, the first order of business before anything is they do have to get an order from their doctor for physical therapy. They do not have to ask for anything special. It's all considered physical therapy. I mean, it helps if they remember to ask for the Parkinson's program, but it's not required.
Okay, and same thing?
Yes, same thing. Physician referral would be required. And back to the family involvement, I think if family are there, during the treatment session, then they can help that patient carry over and encourage them to do their homework exercises, because the homework is an essential piece for both programs.
Well, yeah, it's just like anything else. It sounds like, you go and you get trained on something, then you need to come home and you need to practice it. And the more you practice, the more mobile you're going to become, or the more you're going to be able to speak better.
Sure. And it helps to make the new speech or the new movement a habit. It becomes their new normal. So that's what we want. We want them to be able to then carry that over outside of therapy.
Yeah, so if the brain stops sending the signal, your body's like, hey, this is normal. This is what I'm going to continue doing.
Exactly.
Yeah, well, that's really interesting. So who benefits from this program outside of Parkinson's? Is it just Parkinson's, or are there anybody else that take part in this program?
From the speech standpoint, they have have done some cursory trials of the speech part with patients with apraxia, with cerebral palsy, with multiple sclerosis. They have not done extensive long-term studies on the lasting effects with those particular populations, but with Parkinson's patients, particularly in the early and mid stages of the disease, it's very effective, and they have shown that the effects of the treatment last 2 years and beyond.
Really?
Yes.
Okay. So Parkinson's disease is not curable, but it's treatable.
Correct.
Okay, so this is part of the treatment. Okay, so you said, I was going to ask you that question just a minute ago, at what stage does it work the best? So if someone is just tuning in to this show and they're hearing about this and they're thinking, well, I just don't know if this will benefit me or not. I mean, should they just go ahead and try to reach out to their physician and say, hey, this is something I'd like to try?
Absolutely.
Yes.
Yeah.
Yes.
And then what's the process of that? They get a hold of their physician, they get the referral, and then they come see you. So let's walk through maybe an appointment. Like, how do you get started? What will they expect when they come to see one of you? We'll start with you.
They are evaluated by a physical therapist. They go through some very easy tests, speed, how quickly they're walking, how far they can reach, timed putting on their shoes and taking off. And that gives us a baseline to start with, so that we can measure the progress that they make as we go along in the program. After that, the first appointment will be that evaluation, and then the next appointment is set up with me, and I spend a little bit of time talking with them, finding out exactly what are some things that you cannot do anymore, that really bother you, you'd like to work on. And then we just start right in. We start in with some walking and the exercises themselves. There are 7 basic exercises that you do, and you do them in the same order every time, and we try to make it fun so that it doesn't get boring.
Right, yeah, nobody wants to be part of a boring program. If this is something that's going to benefit them, help them feel better, not isolated.
Right.
So the same thing with the speech therapy program?
Yes, when I receive a referral, I would be the one that evaluates them. And that would entail just kind of gathering a speech sample from them, using some instrumentation to, again, gather a baseline as far as the volume of their voice and the quality of their voice, whether it's raspy or breathy or hoarse sounding. And then the treatment is a very specific hierarchy of exercises that they perform at every session, a very specific amount of times per exercise. And then again, the carryover, the homework activities are also very, very important.
Okay. So is there, I guess, different timelines, different goals per patient? I mean, everyone's different, so I'm guessing all the different stages. Do you have like a goal in mind when you do that first initial evaluation and then see how long the timeline goes, or how long does it take for someone to maybe succeed at something that they would like to get better at?
You end up with the short-term goals, which something that improves pretty quickly is their gait. Most of them have gait issues, so we start with that right away, and they're able to see progress pretty quickly. We then have goals also, like buttoning your shirt or tying your shoes. I had one patient, her big thing was putting on her earrings. She could not get her earrings in the hole, and there are specific hand exercises that you can do to help with that. And the joy on her face when she popped that earring right in there was pretty exciting, actually.
Well, it's just little things like that a lot of people will take for granted, and then once you're not able to do that anymore, it can be frustrating because it may affect your self-esteem. Like, I just don't feel as pretty, these earrings, you know, something like that small can make somebody feel so better about themselves.
Depression is a huge part of this, and once they start seeing results, they start coming out of that and realize that their life is not over, that they can do this.
And it really changes their whole outlook.
I'm sure it does. And then when they're working with you and your people, that they're able to vocalize that better too, right?
Yeah, my husband doesn't ask me to repeat all the time. My friends can hear me when we go to dinner.
Yeah.
All of those real life situations that people want to be able to participate in. So.
Right. And then, you know, I'm hoping that folks who are watching this program, even family members, you know, maybe someone's tuning in, a friend of somebody who maybe is suffering from this, and they can say, hey, did you know there's these therapy programs out there that, you know, this may help.
Yes.
Let's find out about this.
Because lots of Parkinson's patients take medications for their disease and to control the symptoms, but they're finding that the combination of these programs and really emphasizing on the big and the loud movements really help them.
Yeah, that's great to know. So is this covered by insurance? That's something everybody always wants to know. Is this something I have to pay for out of pocket?
It is covered by insurance. It's coded just like any other therapy that we do.
Okay, so it's basically, like you said earlier, just covered under the physical therapy. Same thing with speech therapy. Okay, so is this something that there's other benefits from? I mean, like, is it kind of like exercise, or what are the other benefits except just stretching muscles or just being able to talk better? And we've talked about depression. Is there anything we're leaving out?
I think depression is the huge one.
It's a big one.
It's huge.
Huge.
It's for someone to feel like that they can get pieces of their life back is just paramount, and just going out there and feeling like they can do it. I mean, you know, they're not restricted anymore.
Right. They don't feel so socially isolated anymore.
Right.
I can be an active participant in this conversation, or now I can safely walk into the restaurant and then sit down and have a conversation with my spouse or my friends.
Yeah, you just don't feel so trapped anymore.
Right.
People stop doing the things that they love to do because they're either self-conscious or they're afraid they will fall. It's nice for them to get some of that back.
So this is something that is a treatment program at Horizon Health, but I mean, this is something that is offered with physical therapy in, you know, different organizations, not just locally.
Sure, yeah. There are therapists who are certified in both of these treatment programs all over the world.
Yeah.
And there is a website LSVTglobal.com, I believe, is the one. And if you're in another area, you can put in your zip code and they will show you the people who are certified in this program.
Okay, well,
the program is not given in, you have to be certified to administer this program. Not every clinic does it.
Okay.
But
well, we've talked a lot about the exercising and different things like that. Let's get a little bit more specific into the LOUD program as well. What are some things that a patient can expect, I guess? What are some of the different exercises with speech? Like, what are some things that you do?
In the program, every session, we do what's called long ahs. We do highs and lows, and we will put those put the patient kind of through their paces, as you would say, performing those different exercises in a specific order. And then the other side of that is sometimes when a patient performs an exercise and then you take a break and you're just having a brief chat with them while they're having a drink or taking a rest, you'll find that their voice goes back to the soft, the soft voice that it was. So it's a constant encouragement and reminders to think loud. Remember, that's our that's going to be our new normal. And basically what you're hoping to do is then to recalibrate their sense of, oh, this is how much effort it takes to speak in a voice that can be heard or understood by others.
Well, it's almost like just retraining, it sounds like to me.
Yes.
Or relearning. Or, when I hope this doesn't come across the wrong way, but when you're a child, you're learning how to do things and how to, like in speech class, you think about, I need to talk loud, I need to have, this voice that people can hear. It sounds like you're just trying to relearn a lot of these things because your brain just isn't sending that signal out to remind you.
Right, because the Parkinson's now is interfering with that sensory system, and you don't get that typical feedback that other people would get as far as, is my voice too loud? Am I shuffling my feet? So yeah, it's important to kind of give them a new idea of what normal should sound like.
Okay. Now, what's the average age, or is there an average age? Does this affect anybody?
Yeah, Parkinson's disease can affect, people of all ages. Typically, we would probably you don't see youth typically with this, but
you can.
Yeah, you can.
Yeah. Michael J. Fox was he 26 or 36?
I don't remember
when he was diagnosed.
But
very, very young.
Yeah. So maybe for some folks who would be watching that are of the older population, and they're thinking, "Gosh, I couldn't do that. I just can't do that." And what do you say to those folks?
Sure, you can.
Give us a chance. You can. There are varying. A lot of the exercises are standing, but we can also do them standing with support. We can even do them with you lying down. So, every stage is addressed.
And so you're there to make sure they're not going to fall, they're not going to get hurt. So really nothing to fear, just something to look forward to.
Absolutely.
And to work toward a goal so you can become more active, and become more active not only at home but with your friends and family out in the public.
Right.
Yeah. So we got a couple of minutes left. We've talked about a lot. I'm hoping a lot of people are going to get some helpful information from this. And no, there is hope. Is there anything that you get asked on a normal basis that maybe we haven't discussed so far?
Oh, I think you've hit all of the questions that people really want to know if they can do this. I'm here to say that you can.
Well, that's good to know. Same for you?
Yes.
All right.
I think we hit on all the highlights.
All right. Well, it's been a pleasure having both of you on the show today.
Thanks
so much for your time.
Nice.
Thank you for your time. And thank you so much for joining us on this episode of Being Well. We hope it's been informative. And if you would like more information, visit our website, WEIU.net, and click on Being Well. Thanks for watching.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
At Carl, we dedicate ourselves to helping you be great. And we have the expertise and inspiration to help you stay that way.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HS St. Anthony's Memorial Hospital.